My name is Tammy Wakefield. I work at Green Memorial Hospital. I am a clinical nurse manager for the Med-Surg Tele and the ICU units. I've worked in healthcare for about 10 years. I went to school at Michigan State University and got my bachelor degree in psychology. I wanted to be a child psychologist. When I felt that I could not do that because that's a huge undertaking, I knew that I wanted to take care of people. So what I did is I became a caseworker. I worked at Greene County Jobs and Family Services, and I did the ADC, food stamps, Medicaid, and I wanted more. I wanted direct contact with people to help care for them. So I decided to go back to school to be a nurse. Initially, after getting my nursing degree, I worked at Miami Valley. I was on a Med-Surg Tele unit. I did that for about a year and a half, and I wanted to learn more. So I advanced to a pulmonary unit where we took care of sicker patients. And when I felt that I got enough knowledge in that area, I wanted to take care of all patients. I wanted to work from the ED to the inpatient to the ICU. So I went and I became a float nurse at Grandview. At Grandview, I was able to take care of all types of patients. I took care of them coming through the ED. I took care of, managed them 3 to 4 days on a Med-Surg Tele unit. I would take care of them in the ICU when they were sicker. And I enjoyed it. I loved it at the bedside. I came to Green Memorial to help out with the computer system, and I ended up staying. I became a nurse, a resource nurse on the Med-Surg Tele unit. I did that for about 4 months. And after that point, an opportunity came to me where I could be a clinical nurse manager. I interviewed for that position, and I got that job July 31st, 2012, and I have been doing that ever since. I love it. I manage about 100 staff members. And I round on patients, so I'm still at the bedside, and I love what I do. For a parent or student that's looking into going into the medical field, my advice would be look into the long-term care facilities and hospitals that surround you. Go to them, even volunteer. Once you're able to figure out that that is definitely the best choice for you, what I would do is start at as an aide. See if you can get a job as an aide even, and go and you want to understand every aspect of nursing, and it starts with an aide. I had a patient who she had a need for family support. She expressed to me that she did not have the family support. She did have a daughter. The daughter they didn't have the best relationship. And so what I was able to do was I was able to spend time at the bedside with her, talk about everything when she was a child, up until, everything that she had been through in her life, up until at the time that she was laying in the bed. And I really think that that benefited her. She got better and left the ICU and was able to be discharged from the hospital, and I think that it was really rewarding. I'll never forget her. For individuals who are looking to advance to the medical field, there are plenty of educational opportunities out there. Wright State University, Sinclair Community College, Clark State Community College, and the Greene County Career Center.